We're talking hazard prevention programs here today. And what is a safety connection? A safety connection really is an opportunity to attend in your virtual workspace, to um, you know, facilitate an exchange of best practices and learn and share and figure out what's of value to you. So let's go ahead and talk a little bit more about your own hazard prevention programs. I would love to know, first of all, how many employees your organization has. I would also like to know, do you have an existing HPP and do you have an existing safety program? You can drop that into the chat. Are we talking big organizations? Are we talking small organizations? Are we talking a couple of staff? Are we talking about 15 staff, 20 staff, 100 staff? Um, every organization is a little bit different. And this is really going to help drive who your applicable partner might be. But it also helps understand what your resourcing might be, because some of the challenges that big organizations face are typically very different than the challenges that smaller organizations might face. I don't see anyone chiming in the chat. The chat, of course, is the little speech bubble. You can go ahead to the next slide. And if you wouldn't mind sharing, do you have an applicable partner already? It could be a workplace health and safety committee. If you have 20 or more employees in a workplace, you typically would have, if you're federally regulated, a workplace committee. If you're in a workplace where the total of all of the employees is more than 300, you would have a policy committee. In smaller workplaces where you have 1 to 19, you would typically have a health and safety representative. Now, some organizations may also have a joint health and safety committee for provincially regulated portions of their workplace as well. Curtis says, we've got 15 employees. Yes and yes. Awesome. So you've got an existing HPP. That is amazing. And you've got an existing safety program, which is always great. Great to see. So this is probably going to be for you a little bit more of a refresher on just what is an HPP and how does it work. So let's move into talking a little bit more about hazard prevention programs. What is it? A hazard prevention program is your roadmap to a better health and safety program. It's a list of the hazards that you do have. And with each of the hazards, we then clearly articulate what the risk level is. The goal of the HPP, of course, is to help you build your safety program. And you can only build your safety program once you know what your hazards are and how dangerous they are. We also use our HPP to document the controls that are in place for each of the hazards we have. So it's very logical. It says, okay, we've got a hazard. It's kind of dangerous or really dangerous. What are we going to do about it? Or what are we already doing about it? Then we move into training needs. This also helps drive our ability to understand what the training needs are. And then we use this program also to monitor and adjust. Do we spot new hazards or new concerns? So when we look at why we need an HPP, why do you think an HPP is important? Well, one of the reasons is legislative compliance. The Canada Labour Code Part 2 does require employers to develop, implement, and monitor in consultation with their applicable partner, whether that be a health and safety representative or a committee of some kind, a prescribed program for the prevention of hazards in the workplace appropriate to its size. Remember, we said we're going to talk about right sizing to the size and nature of the hazards of the work. And it also does have to provide for the education of employees in health and safety matters. Now, there is a regulation that provides more detail on exactly how this particular provision of the Canada Labour Code is applied. We have Part 19 of the Canada Occupational Health and Safety Regulations, and that is all about hazard prevention programs. It talks about the steps and it talks about what's expected. So aside from legislation, which is one reason to have an HPP, there are a lot of other reasons why a hazard prevention program is so incredibly valuable. And one of them is to prevent workplace injury. Our goal is to bring more folks home safe at the end of the day, right? We want to prevent injuries in our communities. We want to ensure that our community members and our employees are thriving. We also want to prevent illness. When we think about preventing illness, we're talking about occupational disease, often from exposure to chemical, physical, or biological agents in the workplace. Things like preventing noise induced hearing loss. We're thinking about preventing um, transmissible disease. Some of you have healthcare related work that's being performed where there's potential for disease to be spread that's infectious in nature. We're talking about preventing, um, disease such as occupational dermatitis from exposure to chemicals in workplaces. But we're also thinking about mental harm. And when we think about mental harm in workplaces, this is often from, violence, harassment, trauma. So there's a lot of different types of harm that can happen. We also want to ensure, just circling back to the injury standpoint, that we're including ergonomic concerns in our HPP as well. It is something that's specifically legislated in Part 20, as well as or Part 19, and also in the Canada Labour Code, Part 2. All right, so moving to the next slide, one of the biggest reasons, of course, we want to have an HPP is so that we don't just feel safe. When we think about, oh, well, if you don't know what you don't know, you might feel really safe working with a string trimmer, but if you don't know that the vibration is going to lead to injury, if you don't know that the noise can cause noise-induced hearing loss, if you don't know those weeds are noxious, you might have this sense, this feeling of safety, but you're not actually safe. The goal of this is to not only equip your staff with the information they need about the hazards that they have, so that they understand the risks, they understand exactly how you are working to control those risks. Ultimately, it helps them feel safe in the workplace, but it also helps them be safe. And this benefits everyone. It benefits families, it benefits communities. At the end of the day, we all want to be able to go home in the same condition with all the fingers and toes and hearing that we went to work with. And when it comes to building your safety program, this is how we build an HPP. So it starts with making a plan. And we're going to talk a little bit about some of the elements of the plan. Once we have a plan for how we're going to develop our HPP, the next step is to identify your hazards. We want to know what those hazards are. And once we know what our hazards are, then we assess the level of risk for each of the hazards we have. From there, we want to start thinking about the controls either that we have in place or that we're going to put in place, the training programs we're going to provide to our staff, and we also need to evaluate to be sure that our program is effective, that we're actually reducing risk to an acceptable level. So let's dig into these various steps, starting with making a plan. And you might think, ooh, this seems like a lot. Like, this is a lot of work. How are we going to help manage this? Start by identifying organizationally a change champion, someone who has the ability to, be the leader and help get things organized. This is also someone who can help secure senior leadership's support. Who makes a great champion? Someone who can get your senior leaders just as excited about implementing a hazard prevention program as I am. We need senior leadership support so that they can ensure resources are available for us and so that we're able to all be moving in the same direction toward that implementation. When it comes to identifying resources that help, you have resources inside your workplaces already that can help you on your HPP journey, especially around identifying hazards and risks. And we're going to talk a little bit more about those resources as we go through the program. Don't forget to work together. This is a team effort. This is not going to be a one person doing all the things. We need our frontline staff. We need our supervisors and managers. We need all of our levels of management involved, as well as our applicable partner, committee, or rep involved in this because everyone's jobs are different. We all have these different roles and risks associated with our roles. And so it is truly an all hands on deck approach. And remember that the size of your organization, if you have a really small organization, you are going to have a much more limited HPP. If you have a really large organization, your HPP may be more complex. It may cover a lot more elements, but at the end of the day, the core concepts are all still going to be the same. When it comes to the roles and responsibilities for hazard prevention, senior leaders have responsibilities to ensure that there's adequate resourcing to implement the program, that the program actually does get implemented, and they also do need to take actions where they become aware of serious situations or where the system is starting to break down. Middle management folks have different responsibilities. Often they're responsible for taking the lead in identifying hazards and performing some of those risk assessments, working with their teams and with their staff to gather the information. They also will help to plan, execute, and record any training that's provided to their teams. And they also will work to ensure in their respective areas of responsibility to ensure that any of the corrective actions, controls, that these are actually implemented on their teams. Now, there are also responsibilities for frontline workers. They participate in all of these programs. They'll participate in hazard identification and risk assessments. They participate in training programs. And they also, of course, have to follow all of your, policies and programs, and they have a duty to report hazards and concerns. This becomes important as part of the monitoring strategy for an HPP as well. When new hazards are identified or new concerns are brought forward by staff, this is an opportunity for you to adjust your HPP as you go along. As for your committees or reps, that applicable partner, they're consulted on the development and review of your HPP program. So, as we're planning it, as we're developing it, as we're implementing it, as we're conducting those risk identification, hazard identification, risk assessment processes, they are participating in these processes. They're helping to keep track that all of this is in fact taking place. They also, on a long-term basis, will monitor the effectiveness of the HPP and ensure that it's being adequately maintained. Now, they don't do the maintenance of the program, but their goal is to monitor to ensure that the employer is in fact maintaining the program appropriately. Keywords for the committee would be consulted on. So let's first talk about how to develop our plan. So some things to consider as part of your making your plan include developing timelines. Timelines for each step of the implementation. When are we going to do our hazard assessment? When are we going to do our hazard recognition, which of course comes first? So how are we going to, when are we going to be developing our training programs? We also want to divide and conquer by deciding who's going to do what. We're going to delegate to various folks around our organization what our frontline manager is going to be responsible for, what maybe our safety folks going to be responsible for, or HR if you have an HR person. Even if you have no HR person, having your frontline supervisors or managers taking the lead for their individual division or area can go a long way to helping break this work up. And remember, your managers and your frontline staff know their work the best. So they're in a really good position to be able to help identify hazards and to be able to assess the level of risk involved. We, of course, want to consult with that applicable partner and keep them up to date on the process. This includes providing those timelines that you've established as part of your plan, letting them know if some of your timelines change, keeping them in the loop about your progress, whether your plan is in fact being followed according to the schedule that you created. We also want to, of course, as part of our plan, ensure that we are identifying who can help. So there are internal resources, there are external resources. Internal resources are folks inside your own workplace, folks like your maintenance department, folks like your partner, maybe technical experts that you have internally who can give you a hand. And remember, your staff are also a great source of internal assistance. Now, for external assistance, there's of course WSPS that can help you on your journey to your HPP as well. We also need to decide on an approach that we're going to take. And depending on the size of your workplace, the number of folks that work in your workplace, you may choose to use a location based approach for your HPP. This is looking at a particular building or work area and saying, okay, if I'm working in this area, what are the hazards of this particular area or part of the workplace? I used to work in a laboratory, and for us, as when I was a chemist, um, the lab was the most dangerous place that I typically worked. And so when you think about a location-based model, we think, okay, if I'm working in this lab, what are the risks of this room? What are the risks of the next lab? It has different equipment than I have in my lab. That's the idea of a location-based assessment. Now, there is another way to do this. We could be thinking about it as role-based. So if you have a number of staff that all have the same job or all have the same role, here at WSPS, we have consultants, and we've got more than 100 consultants. And while our tasks and activities do vary based on the type of work we're doing and our particular area of specialty, our jobs do share a lot of similarities. They say, okay, if you are an occupational hygiene consultant, what are all of the risks associated with that role? We might have 15 people that do that, but we may not need to talk to every single one of them. We would get a representative sample and then build our HPP around the idea of that role. Another way we can do this, and this may work well in a smaller organization, is to think based on tasks. So you may have folks that do a number of different tasks that they're, trying to spread the work up amongst your staff. There might be a lot of folks that are kind of, pitching in various areas that may not be their primary area of responsibility. So this is a great opportunity to be able to from a task-based side, to be able to simply say, okay, if you have anyone in any role in any location doing this job or this activity, this is what these are what their hazards are. This is the level of risk, and this is what they need to know to keep themselves safe. So think about your own workplace, about how you think this would best work for you. Then we start looking at the elements of our risk assessment. And the very first, I'm going to look from a task based standpoint, but you could just as equally say role. If you think about a role, it then leads us to the tasks of that role. If we have a location, we want to think about the equipment and materials in that location and the tasks and activities that are being done in that location. So let's take a look at our flow chart here for the risk assessment. We're going to look from a task-based standpoint. And we think about the task itself. What are then the hazards of the task? What could go wrong in the task? We are gathering information about, again, the equipment we're using, the materials that we're using. We're gathering information about the processes and the practices. Once we understand what the hazards of that task are, then we move to the risk assessment portion. This is where we're asking questions about the task. How often am I doing the task? The frequency. How likely is it that I am going to be injured, in fact, performing that task? There are some things we want to factor into likelihood. Then we ask about impact. How serious could the harm be if someone were hurt? These are the three elements that drive our risk level. Is it a very high risk? Is it a high risk, a medium risk, or a low risk? Once we know the risk level using frequency, likelihood, and impact, we then want to think about, once we have our risk level before the controls are in place, imagine that you were working in a world where you had no controls. What's next? The next step is to actually implement the controls themselves. And once we've implemented controls, we want to figure out what our residual risk level is. So the risk of, I'm going to pick mowing a lawn as a good example. There are a lot of different risks. We're going to talk about the task, mowing a lawn. What are all the hazards of mowing a lawn? Well, there's the blade, there's noise, there's vibration, there's noxious weeds. You might even roll over some dog dew from your neighbor's dog. So there are all of these different types of hazards associated with the task of mowing a lawn. Then we ask, how often do we mow lawns? Well, we don't do that in the winter at all. And I, at least at my house, I only have to do it maybe every 2 weeks um, during the growing season, which is like early spring and fall, because in the summer it dies anyway. So, how often am I really doing this? I'm not actually doing it when I think about the big picture. I'm not doing it that often. If I'm a landscaper, I might be doing it frequency every single day, all day. Big difference. And then how likely is it that I'm going to be injured by this? Well, for something like noise, if I have a higher frequency, I actually am going to have a higher probability as well. There are other things where the frequency and likelihood are not as tightly linked. But I think about, if I'm exposed to this for hours and hours and hours a day as a noisy lawnmower, I am getting so much more noise, and my likelihood of developing noise-induced hearing loss is so much higher. Then we want to think about severity and think about the various types of hazards and if an injury or illness did occur, how bad it could be. Then we start thinking this is a great segue into hazard identification. We just talked a little bit about what hazard identification ultimately looks like. So let's dig in a little bit more detail. How do we gather information for our hazard identification? We want to start with our paperwork. You could grab incident investigations, first aid records, workplace inspections from your committee or from your health and safety rep to get a sense of what the hazards and concerns are that have been already identified. And we know that if you've had minor injuries with the first aid record or more serious incidents where you've had an incident investigation performed, you have hazards because they've already hurt someone. But we also can gather hygiene testing data. Maybe you have in fact done testing in the past. Maybe you've done a noise assessment, so you know how noisy this is already. That's a great document to be able to grab. If you're working with chemicals, grab the safety data sheet. That's a great record of the type of hazards of that particular product. You could grab hazard reports or bulletins, government reports. I immediately think of some of the documents that come from ESDC. They have some great hazard bulletins that they put out. You may have health protection programs that are monitoring health. When I think about health protection, I also think about noise and hearing conservation. If you're noticing that, for instance, many of your staff are starting to experience noise-induced hearing loss, as part of a monitoring program, that certainly should be pointing you in the direction that you may have a hazard that you need to address or a concern that needs to be addressed. I also love taking a look at maintenance records to see that things are in fact being maintained. Maintenance records can also give you a really good idea of the types of equipment you have in your workplace. Now, records are a great first start, but we also need to connect with, of course, our workers or employees themselves. Our staff are a great source of information. They understand their jobs well. They are performing these tasks on a regular basis. They'll have a better sense of how often they do a task. They'll have a better sense if they've had near misses and maybe didn't report. They'll have a better sense of exactly how they operate and what is, there's maybe what you say you do versus what you actually do on a day to day basis. By talking to your staff, it's an opportunity to get a real life view of what their day-to-day activities look like. Can you click and show the worker, the employees piece? Awesome. There are also worker complaints and work refusals. If you're having these being brought forward, you have concerns that your staff are already experiencing problems. We can use physical and psychological demands analyses as well. And while those typically do create records, they're usually performed very closely with the employees that do the work. And don't forget to include ergonomic factors and reports of discomfort. This is, again, a giant red flag saying ding, 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 ding. This is not like my ergonomics are not great. And musculoskeletal disorders are likely. Now, our processes, if you pop to the next one, is another way that we can, of course, gather Information, we can think about something as simple as making a grilled cheese sandwich. There's like grating the cheese, and there's slicing the bread, and then assembling it, heating the pan, cooking it, cutting it. All of those different pieces are, you look at the different aspects of the task of a grilled cheese sandwich, and what do you get? You get effectively a job task analysis. We can also take a look at our job procedures. If you do have written procedures for a task, that's a good example of a control, but we can also use this to gauge um, how much information we're providing to staff. We want to think about organization of the work. If I have to like go all the way over there to, find apples, and over there to get bananas, and then back over here for cantaloupe, and I have to do it in that order, that doesn't make a lot of sense. And so we want to identify that this is maybe causing me to have to do a lot of walking. Think about where work is being performed. And that could be, in many cases, anywhere in your community. Staff are not always necessarily just working on the site that you are in control of. And the Canada Labour Code Part 2 does extend to all these various places that folks are working that are not controlled by the employer. We also want to think about energy sources that are being used. I'm going to use the lawnmower as a good example. We've got typically gasoline in those, but it might be an electric lawnmower. That would be something we would want to identify. And then equipment and materials involved. So what are the hazards of the equipment? A lawnmower being a really good example. Though they're really sharp, they're really noisy, and they, of course, have mechanical moving parts. So let's move to the next slide, and we'll talk a little bit more about the various hazard categories, starting with the kind of traditional safety hazards. Traditional safety hazards are all of these potential sources of traumatic injury. They include our mechanical material handling, machines, motor vehicles, and driving in the course of employment. But we also have slip, trip, and fall, working at heights. They all fall into that safety category. So you can click and it'll show the various categories on the slide. We also have hazardous physical agents. These include sources of noise, vibration, extreme temperature, and radiation. And if you click, you'll see those pop up onto the slide as well, Simona. We also have chemical hazards. We want to think about our chemical hazards as liquid, solids, and gases, all of those various chemicals that we use. And where are they found? They could be inside of vehicles. They could be as fuel. They could be exhausts. They could be waste. I think about the lawnmower as a good example. It's got fuel. It's got that exhaust from the burning of the carbon-based fuel. Those are all good examples of chemicals that task would involve. It would also involve vibration of that vibrating lawnmower, noise from the lawnmower. There are a pile of safety hazards associated. And we talked about some biological hazards as well, the noxious weeds and the dog dew as a good example. Biological hazards are sources of viruses and bacteria, molds, fungi, plants, and pests. Ultimately, these are living substances or things produced by living things that have the ability to cause occupational illness or disease in people. We can't forget about those ergonomic or musculoskeletal factors. Look for tasks that involve excessive force, tasks that involve lots of repetition or long duration of having to do the task. There's also awkward or static postures. If someone is having to stay in a particular posture for a long period of time, that's an example of a static posture. But if it's awkward, it means you're getting outside of working neutral. I think about working neutral as like just standing with your hands in front of you. As we start to bend, twist, reach, crouch, kneel, the more awkward and the longer we stay there, the worse it is, and the more likely it is to cause harm. And then we have psychosocial hazards, those factors related to the organization and our work around culture, workload, balance and harassment, even shift work can have an impact on our mental health, and we want to consider those as well. So once we've considered all of our various hazard categories of the particular task, gathered as much information as we can, we then want to think about risk assessment. So with risk assessment, this is where we're first asking with the risk assessment without controls. Imagine a world where you're cutting that lawn and you're not wearing any hearing protection, you're not wearing foot protection, you're just mowing. In fact, I can picture my neighbors who I've seen mow lawn wearing flip-flops, which I rate 0 out of 10. Don't do this. No hearing protection, no foot protection, no eye protection. They got nothing. So then we want to ask, okay, with no controls in place, how often do we do the task? That often doesn't change much. But that is something that when we think about our controls, reducing the frequency sometimes is a control. So how often are we being exposed to this hazard? How often do we do the task? How likely is this to cause harm? And then how severe could the impact be? And we talked about that in a previous slide. So we think about this without controls. And as we start thinking more about assessment, we want to think about various levels. Now, you might look at this and think, oh my goodness, this sounds really complicated. I'm looking at a bunch of different decisions to make. And I promise you that if you do it 3 or 4 times, by the time you've done it 3 or 4 times, it is as easy as tying your shoes. Once you've done it a couple times, it really does get easier. So the first question is of probability is how often do you do the task? If you do it all the time, if you're a landscaper and you're mowing all day long, it would be continuous. It would be an F1. In my case, for my lawn, I would probably be an F3. It's occasional, it's weekly, and I do spend less than an hour a week mowing my lawn, but it's not unusual where it would be once a month. I do it more often than that, so I would go with an F3. Now I'm factoring in this during the growing season. If we were to average it over the course of the entire year, realistically, I would probably be doing it on an unusual basis because I probably do it 12 times a year. Um, but I'm going to go with the period of time where it's in fact being performed. If you have things that you do really sporadically, I would look for an all year from an all year standpoint. Then we ask, how likely is this to result in harm? So if you are with the L scores, you're looking at very likely all the way to almost never going to happen. And be reasonable. We don't want to catastrophize, but we also want to think to ourselves, how much do people know? I want to consider the person doing the task. If it's a young worker or somebody who has no experience in that particular job, they may not, in fact, understand the sequence of events that could lead to harm, increasing the chances that that sequence is, in fact, going to take place and then lead to harm. How close are they to the hazard? If they're somebody who has physical attributes, I'm 5'2" and don't have a spectacularly high lifting capacity, that's something that I would want to factor in. If you stick me at a desk designed for someone 6 foot tall, my chances of getting a musculoskeletal disorder are shockingly high. I'm sitting at a little desk for a whole person right now. We also want to think about any of these predictable human behaviors. Anything that is infinitely easier to do in the unsafe way than it is in the safe way. Think about what the least experienced person would do. Think about what the laziest person you've ever met would do. Those are a couple of good filters to say, yeah, what predictable human behavior would be the most likely outcome here? That'll give you a sense of some of your likelihood. And we use these two scores, a likelihood score and a frequency score, to calculate a probability score. Now, if you click, you'll see that if I have a frequency of a 2, which is daily, but I have a likelihood score of a 5, which is almost never going to happen, it gives me a score of a probability of a 4. You're like, okay, I can work with this. Then we start thinking about our severity. How serious could the harm be? And again, we get a score for that. When we look at a severity score, an S1, this is potentially catastrophic. It's potentially deadly. all the way down to, not likely to cause harm. So if we pop to the next slide, you'll see severity scores. If an incident were to occur, how serious could it be? If it's an S2, it could result in serious injury or illness, or lost time injury. Whereas with an S3, it could be moderate illness or injury with extended medical treatment. For something like a musculoskeletal disorder, an S3 is a totally reasonable possible outcome. Minor injuries would be things like first aid. S5 would be negligible, no injury. So again, we don't want to catastrophize. I always tell people, like, there's a bell curve. Think about a paper cut. Paper cuts can be everything from negligible to no injury to probably needing a Band-Aid, and I think that's going to be the bulk of the bell curve. And then as we get toward the more severe side, we start seeing, sepsis or getting an infection and needing antibiotics, all the way to potentially necrotizing fasciitis, amputation, sepsis death. What are the chances of amputation, sepsis death? Low. I always want you to ask, what's the probability or what's the likelihood of a potential severity? The most likely severity in this scenario is probably a Band-Aid if we're talking about a paper cut, right? So pick the one that is probably the most probable scenario and maybe lean a little bit toward the more severe. We don't want to be like, pretending things are less severe than they really could be. When we think about a motor vehicle incident, that is very, very possible to be a long-term disabling injury. So we want to be reasonable with our assessment. And ultimately, the risk level diagram works exactly the same way. If I have an S2 and I have a P4, I get an R12. You draw the lines. And what does this ultimately mean? If it's red, it's super high, and that's really bad, and you need to control this immediately. If it's in the lighter yellow, this is still a high risk. You need controls ASAP. The kind of brown color is a medium risk, and anything that's in green is a low risk. But one of the things I like about this particular risk model is that it gives you nuance. There's a huge difference between like an R9 and an R15, and I might be reducing the level of risk through controls. I may not get all the way to a low, but maybe I go from like a high medium to like a lower medium. So it gives you a little bit more detailed understanding of the level of risk. So let's move on from assessment to talk about controls. This is ultimately how we reduce the risk. So some controls are specified in the legislation or regulations that says this is exactly how you have to control this hazard and you don't have a choice. There are other controls, though, where we may be looking to gather information, from best practices. Now, one thing we also want to consider is, what does the law say versus what do we have? So if you click forward, I always think, okay, if I'm going to be in compliance, this is what we have. And if it lists 5 things and I have 3 of those things that my organization already has in place, in the future, I'm going to need to do the additional 2 things in the legal compliance to be compliant. So those would be the additional controls that I ultimately need. And you can click forward for that. So what do we need? What have we got? What are we going to do in addition to what we have? As we move forward thinking about controls, there are lots of different sources of information. Of course, we want to start with our legislation and regulations so we can tell whether we are in fact legally compliant. We also want to look at any codes, guidelines, or standards that apply. These come from ESDC, they include the building code, they also include information coming from manufacturers and instructions and specifications. If you buy something, we need to make sure we're following those. But we can also take a look at standards like the CSA standards. They are, in fact, in a CLC2 context, something that is anywhere that it says that the standard is that you have to follow the standard, it becomes legally enforceable. So something like a lockout and tagout program, if you're building one, take a look at the CSA standard says, then you'll know what the expectations are for how to build a great lockout and tagout program. We can take a look at what are best practices in similar industries to yours. Take a look at what other communities are doing. as part of managing their risks. Your communities have similarities to other communities. And if you see a neighboring community that has a really great HPP, really great safety program, this is a great opportunity to phone a friend. And don't forget about your workers. Often they have a wish list. One of my favorite questions anytime I'm interacting with workers is, first of all, what job do you hate the most? That is a great way to identify hazards, but also assess the level of risk. And also, what's your wish list? If you had a blank check and you had to spend it on safety, what would you buy? Your staff, they know their jobs. They have a good sense of what's going to make their jobs easier and better. And we also want to think about a hierarchy of controls. Some controls are a lot more effective than other controls. We always want to think, can I eliminate this completely? If I can't, can I substitute to make this less dangerous? If I can't do that, maybe I can engineer something. All three of those are more effective than the other controls, things like awareness, administrative, and PPE, because they don't rely on human compliance. The less human compliance you can rely on, the more effective your controls ultimately are likely to be. Now, awareness controls are things like alarms or beepers, signage, information. Administrative is policies and programs, and management helping change the way people work. And personal protective equipment is all of the stuff that we physically use or wear. Each one of these types of controls and the various controls within each of the categories has pluses and minuses. You may have, for instance, something like an engineering control that's, a guard that's really good until you have to take it off. And then, or it's really good, but it's not 100%. You think about like a deli slicer, the guard provides partial protection for the blade, but it's not 100% protection. We also want to think about layering our controls. When I think about the guard on a piece of machinery, we say, okay, well, we've got the guard, but we also need training for our staff on the machinery. We may also need a sign on the guard and a sign on the machine that tells us not to remove the guard and there are dangerous pieces. We would want to have a lockout and tagout program and a maintenance program for that particular piece of equipment. And your staff might also need personal protective equipment of some kind, like hearing protection. Maybe we're not able to build damping around the machine to absorb the noise. So we would have personal protective equipment as a part of an overall safety strategy on that one particular element. Usually, the best controls are layered controls. The first step, though, I think in any of our, or one of the steps in any of our control piece of the risk of our HPP is to figure out what controls you already have. Because chances are, lots of folks, when they hear HPP, they immediately think, oh, I'm going to have to do all new stuff. And I say, you probably don't. You may need some additional controls, but chances are you have some things already. So get a list of the controls you have for each of the tasks. When we ask a person, okay, you're doing this, we're mowing the lawn, how are we doing this? I say, oh, well, I wear safety boots. I'm wearing hearing protection. I'm wearing safety glasses. And I'm wearing long pants. And I've had training on how to use a lawnmower. Awesome. We have some controls already in place. And there's a guard. There's a big guard around that particular mower. It has a stop system. So if you let go of the bar, the machine stops. That's a control on that lawnmower. So we want to think about what engineering controls are in place. Are they being maintained? Are they well designed in the first place? Are they in good working condition? Think about the awareness controls in place. Are there labels already? Do you have signage? Do you have good employee training already? Are you keeping this up to date? Who's getting the training? How is this being documented? And you go tick, 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 we're already doing well. Maybe you already have great policies or programs in the administrative component. Maybe your supervisors are already doing a good job of enforcing safety rules. Those are things that we can include. And then list any personal protective equipment you're already using. Maybe you already have the safety boots, you've already got the long pants, you've already got the hearing protection, and you've already got the eye protection. Awesome. We already know that you have those things. And then document that. So as we move forward, Let's talk now about the next stage of this in the risk management piece, which is, of course, you can click forward, Simona. Yeah, when we think about PPE, I always ask, does it fit? Is it being used? I can give you hearing protection, but if you don't put it on, it's not doing you any good. And is it available for the users? So as we think forward, so we've documented the controls we have, then we want to think about new controls. Maybe we aren't happy with the risk level that we're at. Maybe we need new guards or safety system. Maybe we need to improve the ergonomics of something or improve the design. Maybe we need new labels or new signage. Maybe we need to update our training programs, and we'll talk about those in a second. Maybe we need to improve our administrative controls, things like having those managers enforcing rules, but then documenting that they're enforcing them. Or maybe we need to update our policies or procedures. And then when it comes to PPE, maybe we need new or different equipment. Maybe we need more fits. Maybe we need to do better fit testing or choose an option that's more comfortable, that's more likely that it's going to result in improved worker compliance. Now, as we move to thinking about your implementation plan, ultimately, we want to start by assigning responsibilities and timeframes to various folks so that we can implement the changes that we're looking for to reduce the risk and keep our applicable partner up to date on these changes so that our health and safety rep or health and safety committee can see that in fact the HPP is moving forward and where you're at with each of these items. We also want to develop training programs. And ultimately, training programs start by asking, what do people know? Or what do they need to know? When do they need to know it? Who needs to know it? And how we're going to deliver it. Also, how we're going to document it. Now, when do folks need to have training? They need training anytime a new hazard or new information about an existing hazard is found, as well as they need to have training shortly before they work with particular pieces of equipment or materials, any sort of tasks they're performing. Don't train me on how to like take apart the deli slicer and clean the deli slicer 10 months before I have to do it. By the time I actually go and do it, I'm not going to remember absolutely anything about that task or how to do it safely. So we want to be sure they're getting the information in a manner that's timely, but before they're exposed to the hazard. We also want to use our hazard identification process, that hazard identification and risk assessment that we discussed, to help drive our training programs. So we say, okay, I've got a worker that works as a landscaper. What are their tasks or activities that they perform? What are the hazards? And we've gotten to this point. Then we ask, what do they need to know? Well, they need to know about the Canada Labour Code Part 2, the roles and responsibilities and their rights. That's one thing they need to know, because if they're in a Canada Labour Code Part 2 regulated job, they need to know about the code. They also need to know about any personal protective equipment that they need to use and why they need to use it, why this is so important. Why is it important? They need to know the hazards of the job and any of the controls that are being used. They need to know about the hands-on operational training. So things like, how do you use a lawnmower? What's involved? What not to do with it? If I'm mowing on a slope, am I going uppy downy? Don't do that. We go side to sidey. Am I riding on it? Am I pushing it? Don't pull it back on your body. Don't get it above you on a gravity slope. Those are things we want to factor in. So they need the hands-on operational training so that they can put this into practice, and they also need to be trained on what is a hazard prevention program and what's their role in the hazard prevention program. So they need training on the HPP. Now, training records. What do we look for in a great training record? I always look for a training matrix that says this this is their job role, this is the tasks they perform, and these are all the trainings they need. They need WHMIS, they need hearing, conservation training, they need lawnmower training, they need the Canada Labour Code Part 2 training, they need noxious weed training, They need training on tick-borne diseases if they're working as a landscaper outside. We need a syllabus for each of our courses. If we're providing training, I always encourage you to keep your syllabus because I've been, as a health and safety coordinator, asked for proof of training from a regulator, ESDC, and when we could not provide them with what people had learned and show that they actually learned something, obviously it was not good. This was in a previous job. Um, and this is very early on in my time in that job. The training records certainly, they were looking for training records that predated me, but we didn't have any. So yeah, we learned some lessons there. Other things that I would certainly include would be proof of learning. Like sitting someone in front of a computer is one thing, having them complete a quiz is something else. Show, do, teach. I show it to you. We do it a few times together. You teach it back to me. Sign offs, dates, times, signatures can all go a really long way to being able to track what people know and when they learned it. And then when do they need to refresh this? If legislation changes, if new hazards are found, those are all triggers that, as well as a regular refresh, so folks don't forget stuff. As we move into thinking about program evaluation, one of the things we, of course, want to do is reassess now the controls are in place. So we ask the same questions of frequency, likelihood, and impact a second time. Now we're wearing the gear. Now we're doing this stuff. And we ask, what's the residual risk here? Now, where we have a risk level before controls, then we've, of course, put the controls in place. And we're asking, what's the risk level after? If the risk, we, of course, are documenting these controls. That's part of the HPP is I know my hazards. I know how hazardous this is. What am I going to do about it? This is what we're doing. Now, if we are looking at the risk after controls and we say, okay, is the risk, is it acceptable or unacceptable? If we've reduced the risk to the lowest level reasonably acceptable, awesome. We need to then document to be sure the controls are in fact in place and document that we in fact did a risk assessment after so we know the before and after to show that our controls are actually keeping things safer. But what if the risk level is unacceptable? We say, wow, I put controls in place and the risk is still too high. We implement more controls and then we reassess. And only once we've gotten enough controls in place that our risk level, our residual risk is now acceptable, we're then going to be sure that we document and keep track to be sure that these controls are actually being implemented. We also want to maintain our program. Every time there's change in your organization, ask, is this impacting our HPP? Even having an incident and then having to learn something from that incident is an example of change. Where there are changes, we always want to update the HPP and refine it to better reflect our current reality. But at an absolute bare minimum, you must maintain your HPP by performing an HPP evaluation every 3 years. This looks like going and saying, hey, are there new risks? Are there new hazards? Is the risk level still right? Are the controls that we have still working? Do we need to refresh in our training? Have there been folks that have joined our organization? What do we need to do to keep this program living and breathing in our own workplace? There are some great resources available. One comes from canada.ca. That's the ESDC guide on hazard prevention programs. We, of course, also have a great guide for hazard prevention programs here at WSPS. And that is the high-level view of how to create a fantastic HPP. There are great resources, many more free resources at WSPS.ca. We do have some options to, always talk to a consultant. We do have some complimentary offerings. We have training. We also have the Health and Safety Excellence Program with WSIB. And that concludes my conversation about HPP.